You're riding in a car or maybe a boat, train, or airplane. You start to feel nauseous or maybe you have other symptoms like headache, dizziness, or fatigue. You try some of the lifestyle changes from motion sickness and maybe they've helped, but not to the degree that you want. Keep watching because in this video, we're going to talk about over-the-counter medicines you can take to treat and prevent motion sickness. But make sure you watch to the end as I'm going to review some of the lifestyle changes and then we're going to talk about what order you should use the over-the-counter medicines in. So stay tuned. Greetings, health experts. This is Brandon E., your Pharm.D, and welcome to my YouTube channel. We're going to jump right into the topic and talk about our first over-the-counter medicine for motion sickness, and that's Dimenhydrinate. Dimenhydrinate is the active ingredient in the traditional or the original formulation of Dramamine. This product is dual acting in that it can both treat and prevent motion sickness. It can help relieve symptoms like nausea, vomiting, dizziness, and queasiness. For adults, if you're taking the product to prevent motion sickness, you want to take it about a half hour to an hour before you're exposed to the event that can cause motion sickness. And then from there, you can take 1 to 2 tablets every 4 to 6 hours as needed for continued relief with a max of 8 tablets per day. If you want to take the medicine to treat symptoms, take it as soon as you're experiencing the symptoms and then again every 4 to 6 hours as needed. Now with this medicine, it can cause marked drowsiness. So don't take it if you're doing something where you need to be alert, like driving or operating machinery. But this could be good if you're on a long plane ride, or you're riding in a car, you're not the driver, or you're on a boat for a long period of time and you want to relax and go to sleep. The next product we're going to talk about is Dimenhydrinate. And Dimenhydrinate is the active ingredient in Benadryl, which is the allergy medicine, and it's also found in the sleep medicine Unisom. Dimenhydrinate is very similar to the product we just discussed, Dimenhydrinate, as Dimenhydrinate is composed of diphenhydramine and another molecule. Now, Dimenhydrinate isn't FDA approved for motion sickness, but it should help if you have motion sickness symptoms. And you take it similarly to you with the Dimenhydrinate. You want to take it about a half hour to an hour before participating in an activity that can cause motion sickness, and then every 4 to 6 hours as needed. And then for treatment, take it as soon as you're having symptoms, and then again every 4 to 6 hours as needed. The third product we're going to talk about is meclizine. And meclizine is the active ingredient in Bonine or the Dramamine, but the less drowsy formulation. And meclizine is dual acting as well in that it can both treat and prevent symptoms of motion sickness. And with this product, you want to take it about an hour before being exposed to the activity that can cause motion sickness. And the good thing about this medicine is it can last for up to 24 hours. Also, it can cause drowsiness, but like the Dramamine name suggests, it causes less drowsiness than the traditional Dramamine. So meclizine will cause less drowsiness than Dimenhydrinate. And meclizine can help with symptoms like nausea, vomiting, and dizziness that are associated with motion sickness. When taking these 3 products I just discussed, you want to be aware of the side effects, one of which is sedation, which I just discussed. They can also cause dry mouth, urinary retention, and confusion in older individuals. If you have the following conditions, you want to avoid the medicines I just discussed or talk to your doctor or pharmacist before using them. And that's benign prostatic hyperplasia, narrow angle glaucoma, or breathing problems like emphysema or chronic bronchitis. If you've had motion sickness before and you tried one of the medicines we're discussing and it's helped or not helped, let us know in the comments. And if you're enjoying the content and you want to get more information on lifestyle changes and over-the-counter medicines to improve your health, be sure to subscribe to the channel. Now, the next product we're going to talk about is actually not a medicine you take by mouth, but it's an alternative therapy, and that's the acupressure wristbands. One of the most common brand names you might see is C-band. And with these products, they're an elastic wristband that has a plastic knob sewn inside of the wristband that stimulates an acupressure point to relieve nausea and vomiting. They are reusable, they don't cause drowsiness, they have no drug interactions, and they can be stored in a car, unlike medicines, which generally should not be stored in cars due to fluctuations in temperature. And the acupressure wristbands are a good product to use, and they can actually be used in conjunction with the other products we're talking about as well. Okay, now the next product we're going to talk about is actually ginger. And for those of you that like natural alternatives, this is a good option to try. Now, the use of ginger in motion sickness is somewhat controversial as there's conflicting evidence to its effectiveness. But there was a clinical study that showed that taking 1 to 2 grams of ginger as a single dose reduces nausea severity and can increase the time of developing nausea when presented with situations that can trigger motion sickness. So we talked about a few over-the-counter products. Let's put everything together. Let's say you have motion sickness, or you have a history of motion sickness, or you're at risk of motion sickness. What should you do? The first thing you should do is start with the lifestyle changes that we talked about. And I'm going to review some of those now, but go back and watch part 1 of this video and I'll go in a little more depth. And I'll also link that video at the end of this one. But practice the lifestyle changes. If you're in a car or on a plane, avoid digital screens like cell phones, tablets, and Kindles. And also, if you're riding in the car, try focusing on something outside of the car rather than things inside of the car. And also, you want to try to sit in the front seat if you're in a car. And that also goes for a train. If you're riding on a train, try sitting towards the front of the train rather than in the back of the train. And if you're on a boat, try sitting in the middle of the boat or on the upper deck if there is one, and then focus on the horizon rather than things inside of the boat. So if you do these lifestyle changes and you're still having motion sickness symptoms, jump to the over-the-counter medicines. If you want something to make you drowsy, I would start with Dimenhydrinate and take it a half hour to an hour before you're being exposed to the motion sickness symptoms, or immediately when you have the symptoms, and then every 4 to 6 hours as needed. If the Dimenhydrinate doesn't work and you want something to make you drowsy as well, then go to the Diphenhydramine. If you want something that you don't have to take as often, then take meclizine. The good thing about meclizine is it lasts longer than the Dimenhydrinate and Diphenhydramine, as you take it once, as it can last up to 24 hours, whereas the other medicines only last every 4 to 6 hours. Now, if you're taking these products, Diphenhydramine, Dimenhydrinate, and meclizine, don't take them together. Take one or the other. But if you're taking one of the pills and you want to add something else to get additional benefit, you can use one of the acupressure wristbands like C-bands in conjunction with the pills. Now, for the best treatment, it works best to use the lifestyle changes and the over-the-counter medicines. And if you do what we talked about in this video, you can kiss motion sickness goodbye. If you have any questions about things we discussed, let me know in the comments. This is Brandon E., your Pharm.D. Remember to drink water. I hope this video helps.